Okay, let's dive into this. We often think about universal healthcare like the NHS here in the UK and sort of assume, right, that universal means equal for everyone.
Yeah, that's the ideal, the goal.
You need care, the door's open, that's it. Simple.
Well, it's rarely that simple in practice. Research keeps showing us that actual access is much more complex than just having a system in place.
How so?
It's about whether people can, actually use this system effectively. Do they know how? Are there other things getting in the way?
And that's exactly what we're looking at today. We've got this really interesting qualitative study focusing specifically on people with Parkinson's from minority ethnic backgrounds in the UK.
Primarily, yeah, those with South Asian heritage.
And it digs into these less obvious barriers they encounter.
Right. This is based on a study from NPJ Parkinson's disease. And it's qualitative, so they actually talk to people, 21 individuals with Parkinson's from various minority ethnic groups.
Real conversations, real experiences.
Exactly. Not just statistics.
So our mission here is to kind of unpack the main barriers these people talked about using the themes the researchers pulled out to understand why these gaps exist, even in a universal system.
Okay, so theme number one they identified was all about awareness and acceptance of symptoms.
Makes sense. That's the starting point, isn't it? If you don't even recognize a symptom.
You're not going to seek help for it. And the study found a pretty significant lack of awareness about the full range of Parkinson's symptoms in some communities.
Not just the tremor.
Exactly. People knew about the tremor, the shaking. One participant, P13, put it like this. So culturally, they only think about tremors. They don't realize all the other things that go on.
All the other things, like the stiffness, slowness.
And crucially, the non-motor stuff. Fatigue, sleep problems, mood changes, thinking difficulties. Stuff that isn't immediately visible.
So if you're experiencing, say, the non-motor symptoms, you wouldn't necessarily connect that to Parkinson's if all you know is the tremor.
Precisely. The study mentioned people thinking it was maybe a vitamin deficiency or just stress from overwork, things like that.
Which naturally leads to delays in even going to the doctor.
Right. But it doesn't stop there. Even after getting a diagnosis, some participants really struggle to accept it.
Like denial? Or just confusion?
A bit of both, it seems. You have people asking, like P4, why I'm having this problem, or P7 saying, I'm taking tablets and I feel I'm getting worse. There's this confusion because maybe they expected the pills to just, fix everything, not understanding it's progressive.
Okay, and this theme gets even more complex, doesn't it? It wasn't just lack of knowledge, but also stigma and embarrassment.
Yes, this was a really powerful finding, especially around those non-motor symptoms we just mentioned.
Things like urinary issues, constipation, sexual health problems.
Exactly. Things that are sensitive for anyone to discuss, but the study found they carried a particularly heavy weight of stigma in some cultural contexts. Really difficult to talk about.
The study notes this was maybe more pronounced for Muslim participants, but it wasn't exclusive to them. It was seen across different South Asian backgrounds.
That's right. Christian, Hindu, Sikh participants also mentioned similar difficulties. It points to a strong cultural layer influencing this.
There was that quote from P11.
Yes, quite stark. It is to do Pakistani culture. He feels that he is shy and reluctant to discuss. And P5 mentioned feeling quite embarrassing to talk about it, even with her husband there.
Wow. Even with a spouse present.
And P2, who actually had a medical background, still acknowledged it, saying, sexual health is something that a lot of Asian people would have difficulty discussing.
So if it's hard to talk about with family, bringing it up with a doctor,
right.
That's a huge leap.
A massive barrier. It leads to silence around really crucial parts of managing Parkinson's.
And the stigma hit mental health issues hard, too.
Oh, definitely. Things like depression, anxiety. The study found these were often seen not as symptoms, but as personal failings, weakness.
So people would hide it.
P3 said, I don't want anyone to say that, she is struggling. I try to hide a lot. And P5 talked about feeling embarrassed, as if I was weak.
That kind of cultural framing just shuts down the possibility of seeking help, doesn't it?
Completely. When mental health support is so vital with Parkinson.
Okay, so moving beyond the symptoms themselves, the study also looked at the wider picture, sociocultural expectations and impacts.
Right. How do the community's beliefs and norms shape the experience?
So it's not just personal awareness, but what the wider community understands.
Yeah, and often that understanding is limited too. P11 noted, people don't know about the Parkinson's. They see your body features. They see the physical signs, maybe the tremor, but don't grasp the neurological complexity. the hidden aspects.
That must feel incredibly isolating. People see something's different, but they don't really get it.
Adds another layer of difficulty for sure. And then there are these strong cultural expectations, particularly highlighted for South Asian women.
What kind of expectations?
T2 talked about a cultural trait amongst South Asian women, that we don't always put ourselves first. Put on a brave face and crack on.
Crack on. That phrase says so much. Just endure it, don't make a fuss.
Exactly. A kind of cultural stoicism. Keep going. Manage family responsibilities. Don't complain about your own health issues.
Which sounds strong, but in the context of a progressive illness.
It becomes a barrier. It stops people from seeking help when they need it, from getting support. It hinders actually managing the condition effectively.
The study also mentioned something interesting about second-generation immigrants maybe feeling they shouldn't rattle the feathers.
Yes, P2 brought this up. A feeling of needing to be perhaps less demanding within the UK healthcare system, compared to others perceived as more assertive who make a fuss and get what they want.
Like an internalized pressure not to cause trouble.
Potentially. Which again, could lead to not speaking up, not advocating for yourself fully. It's subtle.
Okay, let's shift to the third theme. Access to information and services. So even if you recognize symptoms and navigate the cultural stuff, actually getting the right information and help is another hurdle.
A big one. And sometimes it starts with language. If English isn't your first language, understanding complex health information or communicating symptoms accurately, that's a major challenge.
Lack of translated materials or interpreters?
Can be, yeah. But it went deeper than just language. Participants reported a basic lack of knowledge on how to even access Parkinson's services. Where do you go? Who do you talk to?
Feeling lost in the system.
Very much so. P13 put it bluntly. Nobody told us how to access. We just have to learn ourselves. A real sense of isolation.
And feeling like there just wasn't enough clear guidance available.
Right. And P13 mentioned not getting any written information when diagnosed.
Nothing at diagnosis. That's pretty fundamental.
It leaves you completely adrift right from the start, trying to figure out this huge thing on your own.
Which leads us to the final theme. The actual experiences of healthcare interactions. What happened when people did connect with doctors?
Well, sometimes the barrier was getting through the door in the first place. That fear of stigma we talked about, it could extend to the GP's office. P2 mentioned that worry.
Yeah.
Thinking, oh, why did she come here for this?
And if they did go, the experience wasn't always positive.
No. Some felt dismissed, unheard, symptoms being put down to other things, orthopedic problems, maybe psychological issues, or just flat out not being believed.
Not being believed by your doctor.
Yeah, P6 and P15 shared experiences like that. And feeling like the condition wasn't seen as serious at first, which obviously delays diagnosis and treatment.
Imagine how frustrating and damaging that must be.
Hugely.
Yeah.
And it erodes trust right away. P7 described the diagnostic process feeling impersonal, like the doctor made it all about himself and his diagnosis. For me, it was all about him.
Focused on the label, not the person.
Exactly. And experiences like that make you reluctant to engage further, right?
Yeah.
Even if you need specialist care.
Were there also, system-level problems? Structural barriers?
Oh, yes. Time pressure with GPs was a big one. P13 said GPs haven't got time. That's a common complaint, but it hits harder here.
Plus delays getting appointments.
Significant delays. P13 talked about that. The delay was the medical part. Weren't getting appointments quickly enough. And worries the GPs maybe didn't have enough specialist Parkinson's knowledge.
So you might wait ages for a specialist appointment.
Right. And then even when seeing different specialists, neurologist, physio, OT, whoever participants, felt a real lack of coordination.
Like everyone was working in silos.
Completely. P13 felt stuck in the middle, saying specialists don't seem to get together to talk to each other. P1 saw them as separate services, not really a collective connected service.
So the patient has to try and connect the dots themselves.
Pretty much. People felt they had to constantly fight or push for joined-up care, as P13 said, which takes enormous energy and advocacy skills, especially when you're ill.
A huge extra burden.
And on top of that, a feeling that specific services, like a dedicated PD nurse or easy access to physio, were either lacking or hard to find, again, reinforcing that feeling of being alone in navigating it all.
Now, we need to be clear on a really important point the study made. Despite all these barriers, most participants didn't feel they faced direct racism or discrimination because of their ethnicity or religion in the actual treatment.
That's a crucial nuance, yes. Yeah. P13 was very clear. I don't think we get kind of less or more of a service because of ethnic minority or because we are Muslim.
So the problem wasn't necessarily overt prejudice in the clinic room.
Less about that and more about the system itself not being sufficiently culturally appropriate, not diverse enough in its approach or workforce to really understand and meet the specific needs, communication styles, and cultural context of these communities.
It's a system issue, not necessarily individual bias.
Largely, yes. It's about a system designed perhaps implicitly for a default user and not fully adapted for the diverse reality of the population it serves.
So people wanted what? Better understanding, representation.
Both. They wanted healthcare materials, leaflets, campaigns to reflect them. P2 mentioned wanting to see diversity in adverts. They also noticed the lack of diversity among clinicians. P2 said, I don't know many neurologists who are Asian. And
Cultural sensitivity and care delivery, like P4 finding it hard to communicate with a male physiotherapist.
exactly. Needing options like female practitioners for certain things, respecting cultural norms. It's about tailoring care.
So the study suggests ways forward, like community outreach, better training for clinicians.
Yes, absolutely. Raising awareness in communities, training clinicians on cultural factors, stigma, sensitive questioning, active listening, compassionate care. Also, crucially, increasing diversity in the workforce and materials, making sure information is culturally relevant and in multiple languages. Clear communication is key.
So wrapping this up, the big takeaway seems to be that access is way more than just having the NHS available.
So much more. It's tangled up with cultural understanding, communication, trust, how services are structured, and whether support is truly tailored.
A universal system is the foundation, but it's not the whole building.
Not at all. Achieving real equity means digging into these less visible things, the stigma, the cultural norms like cracking on, the communication breakdowns, the fight for coordinated care.
And understanding these isn't just for improving care for these specific communities, is it? It has broader relevance.
Definitely. Everyone comes to healthcare with their own background, experiences, and communication needs. Addressing these issues makes the system better and more responsive for everyone, especially those with complex long-term conditions.
It shifts the focus from just access to genuinely equitable experience.
Precisely. Appropriateness, responsiveness, equity.